So when you and your oncologist usually will rely on basically our holy Bible of information when it comes to diagnosing, treating, managing cancers. There's a subset of guidelines written by a lot of experts in the country called the NCCN guidelines. And this snippet that I took from that guidelines here, it can be very overwhelming when you look at these guidelines, but I want to just walk through what most oncologists are looking at when they're coming up with this diagnosis and basically the next steps. It's very algorithmic, so to speak, but every patient has completely different stories and completely different symptoms and completely different CAT scans and completely different blood work. So a comprehensive and an individualized plan is really important to talk with your provider. But when someone's suspected of having pancreatic cancer, we already talked about the first thing here, which is to get a CAT scan or an MRI. The next thing that's really important in pancreatic cancer specifically is what we call a multidisciplinary consultation, because there's many different doctors that are involved in this process, not just me or our group, the medical oncologists, but also surgeons. There are surgical oncologists, there are radiation oncologists, there are radiologists, the guys and girls who read these CAT scans, MRIs, ultrasounds, and there are pathologists, the ones who read these microscope biopsies and come up with the diagnosis. There's also interventional radiologists, doctors who can perform procedures like ablations, put in catheters or ports for chemotherapy. So it's a big, huge team that we have, and it's really important that everybody gets involved because, like I said, every case is different. And so meeting with a big group of a multidisciplinary medical team is really important. Social workers, for example, who can help with a lot of the logistics of the treatment planning and transportation and financial concerns. So a big bubble of people. But once we have that multidisciplinary consultation or a tumor board, you may hear it referred to, there's a lot of other things that are important. We kind of already mentioned the CT scans, the ultrasounds, the MRIs, the PET scans, the blood work. There's something listed on this slide here called an ERCP or an endoscopic retrograde cholangiopancreatography. I think it goes without saying that all of these things that I'm talking to you about, pancreatic ductal adenocarcinoma, retrograde cholangiopancreatography, are words that you shouldn't be saying in your everyday life. They're tongue twisters, and there's so many letters and so many syllables, mostly so that you guys can't pronounce it, we can and keep our jobs. But ERCP, so I don't get off on a tangent, is a procedure that can be done if there is a blockage. And we're going to go back to the anatomy in just a minute, but if there's a blockage of the bile duct because of where the pancreatic cancer or tumor is living, that could lead to the yellowing of the skin, where there's an overflow of bile into the bloodstream instead of the natural path where it's supposed to go. So an ERCP is a camera test like the endoscopy, where they can go in and actually place a stent to open up the blocked duct. But that's listed on this slide, so I wanted to mention it.